is derived from a Latin term for enslaved by or bound to. And anyone who struggled to overcome an addiction, whether it was smoking or alcohol, drugs or gambling, or perhaps even sex, would understand the concept of enslavement.
And there are all too many people, even at our boomer age, who still struggle with addictions in their lives. With us now is Dr. Vera Tarman, Medical Director at Renaissance, an addiction treatment facility at Yonge and Bloor, and also the host of a new program on Rogers TV called Addictions Unplugged, which follows Toronto boomers on Thursday nights at 9. Dr. Tarman, welcome, and tell us first of all about your show. How did it come about, and what issues do you cover?
Well, it's a fairly new show. We're now into our 4th show this Thursday. I just pitched the idea to Rogers. I said addictions is a really prominent issue, and ever so prominent now with our mayor. And I mean, people are talking about addiction in a general sense. You know, why not talk about this in a way that people can respond back and have a sort of venue? And sure enough, they went for it. And like I said, we're starting. Medical marijuana is very topical right now, and that's going to be our issue tomorrow. So.
Well, congratulations on the show.
I'm really enjoying it.
Yeah, and it's a 1-hour show?
It's a 1-hour show. It's a call-in show, so people can call in with their opinions or their questions, or, you know, how can I get help? It's really just a way for the community to speak openly and take it out of the dark closets.
You know, like so many of the programs on Rogers TV, it's providing a public service, and good for you. I hope it's very successful for you. Let me ask the first question that I want to ask, though, is, and I'm sure you're asked this all the time, what are the most common addictions that people are afflicted by? And I guess before you answer that, it depends on the age group. So
yeah, it does.
Let's confine it to our audience for boomers. What are boomer addictions?
Okay, well, it has been primarily alcohol. Like in my parents' generation, it's been alcohol. But since the boomers have come along, which now I qualify for myself, it has really expanded to include other substances as well. So we're talking about illegal drugs that we used when we were in our teens and 20s, and also legal drugs like narcotics that are given because of, you know, we're the generation that has arthritis, we're the generation that's getting cancer the most, and we're getting access to these medications, and we're not always using them appropriately. So now we're seeing actually both.
And on the illegal side?
Well, okay, so alcohol would be number 1, legal, and then probably next in line would be marijuana, then cocaine, and then to some degree heroin, or we'll just call it narcotics.
Before we get into those other ones, let's just talk about alcohol first of all.
Yes.
Because I think a lot of boomers would probably be in the same boat that
yes.
I know that perhaps I am, and we enjoy drinking.
Yes.
There's no question.
Yes.
Perhaps many of us very rarely get tipsy, but pretty much every night we'll have a drink or two. And I think a lot of us worry that, does that mean we're actually addicted? Okay. And if we don't drink to excess, does it really matter if we're addicted?
Well, you know, that's a good point. And what's considered safe drinking guidelines actually for a man is 2 to 3 drinks a day, really about 2 a day. Beyond that, and a woman, 1 to 2. It used to be 1, now it's moved up to 2. And beyond that, that's when you run into risks of hypertension and liver cirrhosis and all the rest of that. But if you're doing 1 to 2 a day and you're not tempted to drink more, that's probably fine. But what happens with the boomer population is they've been doing their 2 drinks a day, which really probably is 3 or 4 if you think about the whole day, and then they're retired, and then what do they do? And at Renaissance, I see this happen all the time. Somebody comes in 50, 60. When I retired, idle time, didn't really know what I was going to do. It was just a few drinks a day.
It became easier to drink.
It became easier to drink, and then it becomes a problem.
So let's move on now to the illegal substances.
Yes.
And I find it amazing that boomers are struggling, so many of them are struggling with addictions to things like marijuana, but cocaine and heroin, that's really well over the line for me. So tell us how that's happening.
So one of the things that we have found is that people who used to use drugs when they were in their teens and 20s, now they're older, they have access to money, and we're finding a kind of surge of reusing again. And then there's the people who always use and continue to use. So we're kind of seeing two different populations. But I'm going to give you a scenario which is really like jaw-dropping. I mean, I remember when I first saw this was, oh my God. I'd see an older man, widowed or has divorced his wife, is really naive to the world because he's in the world of business or whatever, meets a really young, attractive woman who does not tell him that she's a cocaine addict or a crack addict. She introduces him to the drug because it makes him virile. Like really, it makes you very sexually active in a way that he probably hasn't experienced for a long time.
So this is more than Viagra.
This is like Viagra 3 times over, well, 10 times over. Wow. Then he's got the money, and she wants to hang out with him, and all of a sudden he's blown his retirement fund. And this is like one of those stories that, oh, I can't believe this has happened, how tragic. But these stories we're seeing more and more. So like I said, there's this resurgence of users. That's very unique to the baby boomer population. Really.
Another addiction that we all know about, of course, is smoking, and I think we all know the causes and effects and so on of smoking. So let's not talk about that. But what about prescription drugs?
Yeah. Good one.
This is a big problem, and I think it's not one that's generally understood as much as it should be.
Yes, you're right. And the thing about the baby boomer population is they pass well. And if you think about it, we have an epidemic of opiate addiction, like OxyContin. Well, OxyContin not now because they finally stopped that company doing it, but opiates like Percocets, Tylenol, 1, 2, 3, 4s, etc. As a GP, if somebody like you or you walks in and says, look, I've got a knee surgery coming up, or I had knee surgery a year ago and my knee really still hurts, I'm not going to think really 3 or 4 like that much about prescribing you a drug because you don't look like you're going to be a problem. But what ends up happening is where are all these drugs? I mean, there's an epidemic out there. Where are they coming from? They're coming from people who pass and then basically sell them or get them stolen or something like that. We call that diversion. Or the person themselves are using them more. And you can ask the question, why are they being abused in this way? Doctors, family doctors, as well as our generation, we're kind of like the guinea pigs. Like in the 60s, 70s, opiates existed, but they were for cancer only. And then there was a big change where they were saying, no, we can use it for all sorts of medications. Yep. And in a way, we're now just learning, whoa, I think we went too far, like the pendulum swung too far. And the baby boomers are the guinea pigs of that. Because you can't just stop that drug. Once you're on it.
And what about antidepressants? Another big category.
Yeah, another big category. Not abused so much, but certainly overused. Because when you're dealing with widowhood, retirement, oh my God, I don't have as much money as I thought I did. How do you deal with that? Well, we prescribe a medication.
So it's partly the prescribing practices that are getting people hooked.
Yes. And the other thing that we haven't seen yet, but I worry about is we are the generation that our fear, growing old, memory loss, et cetera, there's already becoming in the pharmaceutical industry this concept of let's get smart drugs for me because I'm afraid of what's going to happen. And what are those smart drugs? Amphetamines. Yeah. Right.
So smart drugs.
Yes.
How about smart approaches to getting off them? What's the first thing you should do if you realize or recognize that you have an addiction?
To anything.
Well, first of all, admitting it, and that's the hardest problem, and we can see that problem. I don't have to go very far in our community to see that problem. You have to see that you have a problem, and then you have to be willing to make the change. It's very hard when you're drinking 4 drinks a day and you're used to that and comfortable. Even if you realize, I think I've gone a bit over, to actually say, okay, now maybe I have to stop or cut down. So that's the key, is to recognize it and then to.
And then how do you get help?
You would go to your family doctor, and hopefully they'll be attuned enough to. And that's not a given because we're not trained in addiction. That's why addiction doctors are such I think an important phenomena right now. And there's not a lot of education about it. There's 12-step programs also. There is help out there, but not very much, unfortunately.
People, though, eventually get sent to you, to Renaissance.
Yes.
Does your facility only deal with alcohol and drug addictions, or do you also get into the more psychological problems like gambling and sex addiction?
No, actually Renaissance doesn't, but other treatment centers do, like Bellwoods does, Homewood does, and
what about KMH?
KMH does too. Now the thing is that one of the things Renaissance does is we have a private component so that people who can afford service can get it right away. But some of the other places like Bellwoods or Homewoods, which have these what we call behavioral addictions, usually cost a lot of money. And our generation may be able to afford that, but not everybody can. So it's almost a bit like a two-tiered system. If you're an alcoholic, you're more likely to get service that's covered by OHIP, but the other services are not yet really covered by OHIP.
So,
but they need to be.
Well, it does sound like they do, and we only have a minute left. So what advice would you give to our viewers in terms of assessing whether they need help and where to go when they need help?
I think that generally people know somewhere at the bottom of their gut that they have a problem, that they can't stop whatever it is that they're trying to stop. And it just involves picking up a call, picking up the phone, calling a place like Renaissance, and asking for help. It does exist out there. There are services out there.
Is there a hotline, something that,
yeah, there's if you call 211.ca, there's something called DARTS, there's something called MAARS. I think it'll be available somehow. There's a number of places that you can look. Yes, or just watch my show, Addictions Unplugged.
Just watch your show, which is
that's
coming
the advice,
up
okay.
right after this.
Yes.
So,
Right.
Vera, thanks so much for joining us here tonight, and more importantly, for all the work you do, helping people of all ages overcome and what can be crippling and devastating issues for not only for them but for their families. And both of us urge our viewers to stay tuned for Addictions Unplugged following Toronto Boomers, especially if you or someone you know is struggling. We'll be right back.